I thank the ranking member and thank you, Mr. Chairman. When people think of Nevada, they usually picture the Las Vegas Strip. But what many don't realize is that more than 80% of our state is rural, the highest share of any state in the country. My congressional district is one of the 20 largest in America. In fact, only one member of this committee, Congressman Adrian Smith, represents more square miles than I do. So many of my constituents drive 2, 3, or even 4 hours to get to the care that they need. At the end of the day, there is no distinction between rural health care and health care. It is simply the care that people depend on to get the families the health that they need. Here's another figure worth noting. Nevada also has the 6th highest uninsured rate in the nation, and it used to be worse. Before 2014, we had the 2nd highest uninsured rate in America, behind only Texas. What changed? Medicaid expansion. When I served as Majority Leader of the Nevada State Senate, I worked alongside then Republican Governor Brian Sandoval to expand Medicaid under the Affordable Care Act. It wasn't about politics, it was about doing what was right for Nevada's families. That decision reduced Nevada's uninsured rate by more than 5 percentage points, and it extended health care coverage to roughly 135,000 Nevadans. That's why I was so disappointed to see my Republican colleagues move in the opposite direction. The changes that have been enacted through the One Big Ugly Bill are expected to affect health care coverage for more than 147,000 Nevadans and threaten hundreds of health care jobs all across my state. In fact, in one of the rural counties in Nye County, I don't have a birthing center, and there's very limited OBGYN services throughout rural Nevada. And Nevada is hardly alone. The Medicaid cuts are projected to remove roughly $155 billion from rural communities over the next decade. 1 in 5 rural adults and nearly 40% of rural children depend on Medicaid. Those dollars don't just insure patients, they keep rural hospitals open, they sustain EMS services, they support community health centers, and they help long-term care facilities keep their doors open. That is why we as members of Congress should be doing everything in our power to expand coverage in rural America, not restricting it. But instead, we are barreling towards a real coverage gap. Americans will lose their insurance and their access to affordable care. That brings me to today's bill. While I appreciate the intent behind the RPM Access Act, remote patient monitoring only works if patients have coverage, providers, and reliable internet access. Take any one of those out of the equation and the promise of telehealth falls short. While not in our committee's jurisdiction, reliable broadband connectivity is the backbone of telehealth. And yet Speaker Johnson allowed the Affordable Connectivity Program to expire, a program that was found to increase rural broadband connectivity by 7%. Without affordable access, rural families will continue to lose access not only to telehealth, but also to education, employment, and economic opportunities at large. So to be clear, yes, I will vote for this bill, but let's not confuse passing one telehealth bill without a comprehensive commitment to health care in rural America. Rural America needs providers, it needs hospitals, it needs broadband, and above all, it needs affordable health coverage. And until we protect all of those pieces, our work is not finished. With that, I yield back.